Hello, and welcome to this episode of In Discussion With from Pharmacy Update Online. Today, I'm talking to Dr. Catherine Anne Busuttil about vitamin D point-of-care testing in community pharmacy. Please, could you start by introducing yourself?
My name is Catherine Anne Busuttil. I'm a 27-year-old clinical community pharmacist. I completed a Bachelor in Pharmaceutical Science degree in 2018, followed by a Master of Pharmacy the following year. I continued my studies with a 3-year doctorate in pharmacy offered by the University of Malta in collaboration with the University of Illinois at Chicago. During the course, I was exposed to rotations in hospital pharmacy, community pharmacy, and regulatory sciences. As part of the course, I carried out practice research in the area of vitamin D point-of-care testing, which was supervised by Dr. Francesca Wirth and Professor Lilian Azzopardi from the Department of Pharmacy at the University of Malta. I now contribute to the department as a teacher practitioner for second-year pharmacy students in the point-of-care testing practicals and for postgraduate students on their community pharmacy rotations.
Can you give us a brief overview of your role, what your current job involves?
I practice as a clinical community pharmacist within a group of pharmacies. Within the group, the impact of point-of-care service provision within a primary care setting is widely recognized, offering a portfolio for point-of-care tests. This enhances the role of the pharmacist beyond dispensing, adding a clinical flair to the service afforded to patients, which benefit from early screening and non-invasive monitoring of diseases, coupled with personalized advice and referral as needed.
Now, you are the first author on a recent publication entitled Establishing a Community Pharmacist-Led Vitamin D Point-of-Care Testing Service. And this is what I'd like to explore in this interview. But first, could you tell us a little about the thinking behind this project, why it was worth doing?
The involvement of vitamin D in multiple disease states beyond bone health is being recognized worldwide. The increase in demand for vitamin D supplementation to boost immunity during the COVID-19 pandemic is what led us to select vitamin D point-of-care testing as an area of study. Being a fat-soluble vitamin, inadequate levels of vitamin D may be harmful to patients. The inaccessibility of inexpensive, non-invasive, quick, and reliable methods of vitamin D assessment sparked my interest in vitamin D point-of-care testing methods. Pharmacists working in a community setting are situated ideally to offer guidance on vitamin D supplementation, supporting various ailments, and unveiling a niche for the development of a pharmacist-led service.
And how many different devices are there available for point-of-care testing for vitamin D?
So in total, 7 devices were appraised, assessing manufacturer, technology used, storage and stability, specimen type, testing time, results, testing range, quality control, sensitivity, and cost. Locally, 3 point-of-care testing devices are available and use immunochromatographic technology. The main difference between them is that one gives a semi-quantitative result, which is read by the analyst, while the other 2 involve the use of a secondary device, which gives a quantitative result. The secondary device is a cube reader or a mobile phone application. The devices which give quantitative results are significantly higher in cost. The device selected for use was the Acrobiotech Inc. Vitamin D Rapid Test Cassette, giving a semi-quantitative result at a cost of €6 per test, not including additional consumables and pharmacy fees. The selected device is very easy to use and is minimally invasive to patient, giving the result within 10 minutes. The lack of need of apparatus to read the result makes the test most accessible and adapted to ambulatory care settings.
And how was the point-of-care testing result compared with the gold standard?
The identified point-of-care test device was validated against the gold standard method, which is high-performance liquid chromatography tandem mass spectrometry, in 20 participants at the laboratory of the Main Acute General Hospital in Malta. Participants were invited into the study by a consultant gastroenterologist by convenience sampling, through provision of a participant information sheet, and were recruited upon providing written informed consent. Vitamin D point-of-care testing was carried out on the same day as intravenous blood sampling for assessment of vitamin D levels using the gold standard method. The Cohen's kappa test was used to assess concordance between the two methods, giving a value of 0.84, which signifies near perfect agreement between the two results.